I decided to post this because of another video that somebody with Ehlers-Danlos syndrome had. Her name is Ray. This is a video response to it. My name's Storm. I have EDS type 4, excuse me, vascular, but I also have severe hypermobility. I am 16 weeks pregnant, and so far baby is happy, squirmy, and healthy. I've had high blood pressure and a lot of mood issues with this. Fear of myself dying, fear of the baby dying, fear of being more crippled. Sounds kind of harsh to say crippled, but that's what I am. It's hard for me to get out of bed every day. It's hard for me to do things that normal people can, but I push myself because it needs to be done, and I hate letting my condition prevent me from doing things. I hate that, even though I regret it later. I developed a hernia over the past few days because of it. I get told that EDS doesn't exist. It's in my head. I recently spent 24 hours in a psych ward because I sat there and I had my shoulder dislocate while I was in the hospital for the baby, in front of a doctor, in front of a resident, and in front of an x-ray tech. And the resident decided to put in my chart that I was dislocating both of my shoulders in front of her and asking for narcotics. Well, there's one problem with that. My shoulder's fused, my left one is. I have no joint there. I have screws, plates, and bone grafts. And I told her very specifically, I would rather put a bullet in my head than deal with the humiliation we have to deal with every single day of being told that we're faking it, that we just want drugs, crap like that. So she told me I could go to the psych ward voluntarily for 24 hours, which by law means I can sign myself right back out as long as I am not a danger to myself or others, or I can go in for 96 hours. I chose the 24-hour one, and it helped because I was able to get on some medicine to help me sleep, and on Prozac to help my mood, which is great. I told the doctor at the psych ward that she said that she watched me dislocate my left shoulder and that my left shoulder was fused, and he said she was more crazy than I am. That kind of got a laugh out of me. I live with my dad, who's also terminally ill. He has congestive heart failure, and we got into an argument today because I can't keep up with him and myself cleaning wise. And he told me, but you don't look sick. I'm 29 years old, and I know this video quality is grainy. I look 10 years younger. I got the smooth velvety skin, the high cheekbones, and all that wonderful crap. Makes for an awesome time when you go to the store and your legs and your hips are too sore to walk, so you use one of those carts and you get glared at. I've been told that I was selfish. I've been told that I'm a faker by people in a store who have no idea who I am, no idea what's wrong with me. It has affected relationships in my life. It has affected friendships, even with my family. It's affected intimate relationships, sometimes in funny manners. People joke that I'm fragile, that I'm broken. I am fragile and I am broken. Being described as a doll with bad stitching, as Ray did in her video. It's a very, very good way to describe this. I was told this past summer I would have to have my right shoulder fused, which means a bilateral fusion, or possibly even amputated. Then I found out I was pregnant. Well, I'm not gonna give this baby up. It's dangerous for me, but baby is more important in some ways, I guess. I work hard to advocate for what I have to go through. I talk to EMTs, I talk to paramedics, I talk to the nurses. I talked to one nurse recently, and he had just found out that one of his friends is diagnosed with EDS. And I gave him some information about it and everything else. I think it was, in a way, fate for him to meet me. He stood up to me when a doctor just wanted to yank my arm back into place because I had an anterior dislocation of my right shoulder. And he stood up for me to that doctor. I recently, about 3 months ago, had a doctor refuse to treat me. He told me, of all things, I had Munchausen's by proxy, which means that I hurt somebody to get attention for myself. I apparently also have multiple personality syndrome then, because, well, I'm not hurting anybody, not even myself, unless, I randomly step wrong and dislocate my knee or my ankle or whatever. People tell me all the time I'm lucky because I get to sit on my ass all day and do nothing. I sit on my ass because when I stand up, my knees bend backward. People ask me what's wrong with my arm because I hold my left arm to my side because I can't move it. I have screws, plates, and bone grafts. You can kind of see the deformation and scarring there. I think I've had a total of 13 surgeries because of EDS. I've lost track. Somebody told me I was a doctor shopper a couple weeks ago. Well, when you go to a doctor and he sees you once or twice, then he tells you there's nothing that he can do, and he sends you to a physical therapist, and the first time you lift a 5-pound weight, your shoulder separates. You're going to go find another doctor. Or if you go to a doctor and he tells you that he won't perform surgery on you because another doctor already has, and he doesn't want to fuck that guy's surgery up. I mean, what are you supposed to do? Just say, okay, I'm going to sit here and have a dislocated shoulder until it decides to randomly go back in on its own. Sure, right. They've wanted me to do that. When I was in the psych ward, because of the dislocated shoulder and the idiot doctor, they didn't do anything for my shoulder. They didn't give me pain meds. They didn't do anything. Ice packs is what I got. I didn't ask for anything until the very, very end when it was getting bad enough I couldn't sleep. One of the nurses tried to advocate for me to get some sort of pain meds. I didn't get any. I came home, I laid on my dad's bed, and I got some of those old-fashioned sand weights, put them on my arm, laid on my side, and over a course of 3 hours, my shoulder slid into socket. When I was explaining to my OBGYN, a lot of people with EDS are on a cocktail of narcotics. There's people I know that are on morphine, Dilaudid, even methadone, Oxycontin. I take Tylenol. I take ibuprofen. If I have an acute issue like a dislocation, they might give me up some Percocet to go home. And that was before I was pregnant. I have not been on a strict regimen since my shoulder was fused in 2008. So if I'm such a drug addict and such a drug seeker, why haven't I pursued a pain management doctor to take care of all that? Because I can deal with most of the pain. Most of it. I have my bad days, I have my good days, just like everybody else. I try to deal with what I have to go through with humor. One of the screws in my shoulder broke a long time ago, so I say I literally have a screw loose. I joke that I will be forever young because of the soft velvety skin. My baby has a 50% chance of having EDS type 4. And if I get rid of her, she has a 0% chance. She deserves the chance to live, just like I deserved a chance to live. But I also deserve the chance, and I have the right to have that ability to live with some sort of management of my condition, be it pain meds, braces, things like that. I can't afford a lot of it, but I'm trying. I don't want hardcore drugs for the pain because of the baby. But I'm doing my best. I am damn well doing my best. People can think otherwise, but they can't live in my life, and I wouldn't wish this on anyone in the world, except for maybe for them to live a day with Ehlers-Danlos syndrome, which I think would probably kill him. I had a doctor refuse to put my shoulder back in place, so I walked out AMA. 6 months later, I went back to the same hospital with a friend of mine who was sick, and I ran into him, and he had a shoulder immobilizer on, and I'm pretty recognizable because of the hair and tattoos. And he's like, I tried to put your shoulder back in a while ago. I'm like, yeah, you tried to yank on it. And he's like, I'm really sorry. I'm like, did you dislocate your shoulder? Yeah, I did. I am really sorry for how I treated you. I had another idiot doctor decide to give me ketamine to relocate a shoulder. He learned his lesson when I kicked him in the stomach with both feet. Sure, give somebody like me ketamine with dislocations and then hurt them. Not a good idea. I think my message is, we all go through it. We live in excruciating, horrendous pain that very few people can understand. We have our issues and our trials with the medical professionals, with the people that we live with every day. But the people who have this, like me and Ray and a few others I know, well, we have each other. Sometimes that has to be good enough. Maybe it won't be. Maybe it will be. Who knows? I'm in St. Louis, Missouri, by the way, and you can find me on Facebook as Storm Swanson. Black and white picture of me. If anybody wants help or advice or wants to give help, or Schrodinger? Sorry, Kat decided she wanted to be on cam. This is Schrodinger. But if somebody needs help or wants help, drop me a message here or on Facebook. I will do my best to help you. God bless and good luck.